Hi, today we're going to be talking about overactive versus underactive muscles. This video is for educational purposes only. This is to help you to pass your personal training exam or kinesiology exam. Is not to treat or diagnose. If you have any questions about your personal care, please contact your physician. Our muscles work together to produce movement. When one muscle is working, another one is relaxing. But sometimes when we're injured or a muscle is weak, another muscle might start to compensate for that injury or weak muscle. And you end up with a muscle imbalance, which is what we're going to be talking about today. Just remember for your test that an overactive muscle needs to be stretched and an underactive muscle needs to be strengthened. You can identify muscle imbalances by looking at someone's standing, squat, or pushing posture. Good posture looks like this. In a standing position, you want to think of a neutral line. So your head is looking straight ahead, your spine is neutral, it's straight, your pelvis is leveled, your shoulders are leveled, head is neutral, feet and ankles and knees are all straight and neutral. For the overhead squat, you're going to want your feet and ankles to be neutral. Put your arms above your head and squat until your thighs are parallel to the ground. So think of about chair height. Feet and ankles are going to be straight. Knees are going to be over the second and third toe. And your trunk and arms are going to be neutral. Low back is not arching and arms are not falling forward. So if someone's arms start to go forward or their feet are sticking out, their knees are caving in, you're having some type of muscle imbalance. For the pushing assessment, you're going to want to be using a weight machine. The client's going to start with a narrow split stance. Feet are going to be pointing straight and push the weight in a slow tempo. If you notice their back is arching, their shoulders are elevated, their head is jutting forward, that is a sign of a muscle imbalance. Reassess their posture often. It can change over time with injuries, with different diagnoses. I just had a baby, so I have a lot of muscle imbalances right now. Also evaluate yourself to help you study. That's what I did to help myself study for the exam. I noticed my feet were pointing out, and then I looked in my handbook to see, okay, what stretches do I need to be doing to fix this, and what muscles do I need to be strengthening. So that can also help you remember which muscles are overworked or underworked for your exam. Let's go ahead and review the muscles before we start talking about them. I like to remember them by their common name and what problems are associated with that muscle. That just helps me understand and memorize it better. So the gastrocnemius or the soleus, that's around your calf muscle. Your adductor complex is the medial compartment of your thigh. It's mostly that inner thigh. It starts on the pubis bone and goes to the medial posterior surface of the femur. So think of that inner thigh. The hip flexors, think of the front of the hip. So it includes the psoas major, the rectus femoris, the sartorius. Your hamstrings are the back of your thigh. That one's, most people know where the hamstrings are. Your gluteus maximus or medius, that's your butt region. The tensor fascia latae is the outside of the hip. And your anterior posterior tibialis, I like to think of that as more of my shin region. The posterior tibialis is a little bit behind it, the shin, but it's generally in that region. And that's kind of all you need to know just for the personal training exam. So that's your lower muscle region. These are your upper muscles. So the latissimus dorsi, that's the large muscle on your back. It goes under the shoulder blade to the pelvis. The lumbar extensors, those are around your spine. So the rector spinae and the multifundus. So these are our trapezius muscles. The upper trapezius muscles those are the neck to the shoulders, what most people refer to when they talk about their traps. The middle, it's in that middle region, and then the lower, that's closer to the spine. So as you can see here, the lower trapezius starts at that T6 of the spine. Teres major attaches to the scapula and the humerus. Your posterior deltoids, those are the back of your shoulders. And then you have the rotator cuff. That's a group of muscles around that shoulder joint. You hear a lot of people talking about have a rotator cuff tear. So that's how I like to remember it, is a lot of times you're having issues with your shoulder if you have a tear in your rotator cuff. Your rhomboids connect your shoulder blades to your spine, and the levator scapulae, that connects your upper neck to the shoulder blade. That's also a more posterior muscle. Now let's move on to our next set of muscles. Let's start with our deep cervical flexors. That's near the front of the neck. I had a hard time finding a picture, but just know it's near the front of your neck. And the sternocleidomastoid, that's on the side of your neck. It starts near the ear and goes towards the side of the neck. So that's more of an anterior muscle. We have our pectoralis major or minor. Those are your chest muscles. You hear people talking a lot about their pecs. That's what they're referring to. Your abdominals, that's your core. The external obliques, that's the side of the core, and the rectus abdominis, that's the front of the core. So a lot of postpartum women will have the diastasis recti. That's how I remember what the rectus abdominis is, because those are the muscles that are injured when pregnant women have that. Okay, here's a chart talking about your overactive muscles, or the muscles that need to be stretched. You can go ahead and take a picture of it, use it to study. I just like remembering things in groups because it helps me when I'm trying to memorize things for a test. Here are the underactive muscles, or muscles that need to be strengthened. So once again, go ahead and take a picture of it, a screenshot, and you can use that to help you study. Okay, now we're going to be talking about different conditions, what they look like, how to remember them, and the muscles that are overactive and underactive. So first we're going to start with the pes planus. That looks like a collapsed arch. So think of flat feet. Valgus knees, those are turned in knees, and hip abducted. So think of the turned in hips. I like to remember this by Disney knees, if you've seen that on TikTok. So a lot of Disney stars, when they're singing, they'll put their hips and knees pointed inward. The overactive muscles, or the muscles that need to be stretched, if someone has this, are your gastrocnemius or your soleus. That's your calf muscle, your adductors in those hips, in the front hips, and the hip flexors. The underactive muscles are the anterior and posterior tibialis, so your shins, and your gluteus maximus, or your bottom. So those are the muscles that need to be strengthened. With the lower cross syndrome, patients usually have flexed hips, the pelvis is anteriorly tilted, so it's pointing forward, and the lumbar spine is in lordosis. So it's making a bigger curve. The muscles that are overactive or that need to be stretched are your hip flexors and your lumbar extensors. The underactive muscles are the hamstrings, the abdominals, and the gluteus maximus. So you're going to want to work the back of your legs, your abs, and your bottom. I like to think of the upper cross syndrome as Quasimodo in the Hunchback of Notre Dame. So you're going to have the thoracic spine. So it's going to be that hunchback, the shoulders are protracted, and the head and neck is jutting forward. Your overactive muscles are the pectoralis major or minor, the levator scapula, sternocleidomastoid, and the upper trapezius. So the muscles we need to stretch are our chest, the top of our shoulders, and the side of our necks. The underactive muscles are the middle and lower trapezius, the rhomboids, and the deep cervical flexors. So the front of our neck and the middle of that back, closer to our spine. If your feet are turned out and making a pizza shape, that means you need to stretch your gastrocnemius and your hamstring, so that calf and the back of your legs. You also need to work your anterior and posterior tibialis and then your gluteus maximus and medius. You can almost guarantee that if something is wrong with the lower half of your body, your butt is probably underactive and you need to start strengthening your bottom. The valgus knees, once again, it's those Disney knees. The knees are pointed in, they cave in. The overactive muscle is the tensor muscle, the adductor complex, so those both need to be strengthened. The underactive muscle are the anterior and posterior tibialis, and once again, the gluteus maximus and medius. If someone has a low back arch, our overactive muscles are our hip flexors, our lumbar extensors, and our latissimus dorsi. So those all need to be stretched. Our underactive muscles are our gluteus maximus, our hamstring, and our abdominals. Those need to be strengthened. If someone's torso is leaning forward, especially when they're doing a squat, that means our hip flexors, our gastrocnemius, our rectus abdominis, and our external obliques all need to be stretched. They're overactive. And our gluteus maximus, our hamstrings, and our lumbar extensors are all underactive. So we need to strengthen those. If someone's arms are falling forward, that means the overactive muscle is the latissimus dorsi, the pectoralis major or minor, and the tres major. Those are all overactive and need to be stretched. And our underactive muscles are the middle and lower trapezius, the rhomboids, and the posterior deltoids. Those need to be strengthened. If the scapular is elevated, so if those shoulders are trying to touch those ears, that means the levator scapulae and the upper trapezius are both overactive. They need to be stretched, and the lower traps are underactive and need to be strengthened. So you see a lot that the lower traps usually need to be strengthened and the upper traps need to be stretched. If the head is jutted forward, so if your head is sticking out, the overactive muscle is the levator scapulae and the sternocleidomastoid, and the underactive muscle is the deep cervical flexor. Okay, thank you so much. If you have any questions, please feel free to comment below, and if there are any other videos you'd like to see as well, please comment and make sure to subscribe. Thank you. Good luck on your test.